Probably the most significant muscles of the head are those which are often described as the muscles of the facial expression. In many instances, they differ from other skeletal muscles because they insert into the skin or other muscles instead of a bone. This allows for greater variety of movements, and consequently a wide number of facial expressions and emotions are possible. For example, the Zygomaticus major muscle draws the corner of the mouth outward and upward, and has often been referred to as the smiling muscle. The Orbicularis oris muscle is involved in puckering the lips and is sometimes called the kissing muscle. The buccinator muscle in the cheek area helps puff out the cheeks, which is consequently being called the Trapezius muscle. Other examples include the frontalis muscle, which helps raise the eyebrows, the risorius, which draws the corners of the mouth laterally as intention for false smiling, and the platysma, which pulls the lower lip down the back as in look of horror. Another important group of muscles are the muscles of the mastication, which have to do with the chewing and grinding of food. This group of muscles include the temporalis, the masseter, and the internal pterygoid, and the external pterygoid. As you might guess, the temporalis is so named because it is attached to the temporal bone. The word masseter comes from the Greek word for chewer. Pterygoid muscles are also named for one of their attachments, which is the pterygoid, or the wing-shaped portion of the cephalobone. As the top of the head is covered by the combination of two muscles, the frontalis muscle in the forehead area and the occipital muscles in the back of the head, plus a tendinous sheet of tissue over the top of the cranium called the galea epineurotica. The term epineurosis is used to refer to any broad flat tendon in the body. This entire structure is often referred to as the occipital frontalis or the epicranius. In addition to the platysma muscles mentioned earlier, another important muscle of the neck area is the sternocleidomastoides. This large muscle is important for its action of the moving the head, but also is noted for the fact that the distance between the lateral margins of the two muscles marks the widest part of the neck. The sternocleidomastoides also serves as an anatomical guide for locating the major muscles in the neck, which lie behind the medial border. Located in front of the neck area is a region referred to as the anterior cervical triangle. This region is noted because it outlines the vicinity in the common carotid artery and the internal jugular vein are located. The boundaries of the anterior cervical triangle are as follows: the midline of the neck, which is the medial boundary, the inferior margin of the mandible, which is the superior boundary, the anterior border of the sternocleidomastoides, which is the lateral boundary. As you can imagine, these muscles of the face and neck area are extremely important for the various actions and expressions they impart, but are also important for providing the surface shape and form of the body. The Pectoralis Major is an important muscle located in the anterior chest area and is involved with moving the upper arm. It is appropriately named. The word pectoral comes from the Latin word breast. Also in the thoracic area, there are intercostal muscles, meaning between the ribs. These include both the internal and external intercostals. They are important in their involvement in the expansion and contraction of the thoracic area, which occurs during breathing. Along with the intercostals, the phrenic muscle, or diaphragm, is extremely important in the breathing process. The diaphragm is often described as a dome-shaped sheet of muscle which forms the floor of the thoracic cavity, or conversely, the roof of the abdominal cavity. During breathing, the diaphragm flattens out and enlarges the size of the thoracic cavity, which helps draw air into the lungs. The diaphragm contains several main openings to allow the passage of major structures between the thoracic abdominal cavities. These main openings include the esophageal orifice, or the esophagus, or the vena cava orifice, or the inferior vena cava, and the aortic orifice, for passage of the aorta. When the aorta passes through the diaphragm, its designation changes from the thoracic to abdominal aorta. In addition to these openings, the center of the diaphragm is composed of a sheet of tendon referred to as the central tendon. The muscles of the abdomen are often categorized by the general location, such as the anterior medial, the anterior lateral, and the posterior abdomen. These muscles tend to be arranged in several layers, which the muscle fibers of each layer running at different angles. This makes for a strong, supportive structure to enclose and protect the abdominal organs. The rectus abdominis muscle is one of the anterior medial abdomen muscles and runs the sternum and rib cage straight down to the pubic bone. The external and internal oblique muscles run at angles down the anterior lateral part of the abdomen, with the transverse muscles underneath them. An important posterior abdominal muscle is the psoas major, which runs from the lumbar vertebrae down to the femur. Not only is it involved in moving the femur, but along the medial border of the psoas major runs the external iliac artery and veins, so the muscles serve as an anatomical guide in locating these important vessels. Two significant muscles of the back are the trapezius, which comes from the Latin word for trapezoid shaped, and the Latissimus Dorsi from the Latin words for wide and back. The trapezius is the upper back and actually runs from the back of the occipital bone down to the thoracic vertebrae. and over the acromion of the scapula. The Latissimus Dorsi is a large lower back muscle which is attached to the humerus and is involved in movement. The Erector Spinae, which is another group of muscles in the back, which run vertically from the lower back area up to the more superior vertebrae and ribs. As the name implies, these muscles are primarily involved in movement of the vertebral column and keep the spine in an erect position. The deltoid is a large triangular-shaped muscle making up most of the mass of the shoulder area. It is involved mainly in abduction of the humerus. Also, the Pterygoid Major muscle, which runs from the scapula to the upper part of the humerus, is involved in movements of the upper arm. It is also noted for the fact that it serves as the point at which the axillary artery terminates and becomes known as the brachial artery. In the upper arm area, the Coracobrachialis muscle is an example of which is named for its points of attachment. The coracoid, which is Greek word for raven or crow's beak, often a process of the scapula in the upper part of the arm, or brachium. Besides its actions in the moving of the arm, the Coracobrachialis serves as the anatomical guide for the axillary artery, which is located just behind its medial border. The upper arm also contains several muscles which are involved in flexing and extending the elbow joint. The flexors on the anterior surface include the brachialis and the biceps brachii, and on the back of the humerus is the triceps brachii, which extend the elbow joint. There is a number of muscles in the forearm area which have to do with the movements of the forearm bones in the wrist and the fingers. The Brachial Radialis is a muscle located in the superior lateral part of the forearm which assists the brachialis and biceps brachii muscles in flexing the forearm. Another important example includes the supinator and the pronator muscles, which, as their names imply, have to do with the supination and pronation of the hand. The Flexor carpi radialis and the Flexor carpi ulnaris muscles are also appropriately named as they act to flex the wrist. In addition to the action, the tendons of these muscles in the wrist area serve as important anatomical guides in locating the radial and ulnar arteries, which lie just lateral to the respective tendons. Another forearm muscle, the Flexor Digitorum Superficialis, has to do with flexing the digits, or fingers. Gluteus maximus muscle makes up the bulk of the buttocks area, and is important for its action of extending the thigh. In the anterior femoral region, there is a group of 4 muscles called the Quadriceps, which includes the rectus femoris and the 3 vastus muscles. These muscles serve to extend the lower leg at the knee joint. Also, on the anterior surface of the thigh is the Sartorius Muscle, which is a superficial strap-like muscle running obliquely across the thigh to the inner side of the knee area. The Sartorius is important for its involvement as the lateral boundary of the femoral triangle. The femoral triangle is a region on the superior anterior surface of the thigh, which serves as an important anatomical guide in locating the femoral vessels, which run through the center of the triangular area. The boundaries of the femoral triangle are as follows: superior, the inguinal ligament; medial, the adductor longus muscle; lateral, sartorius muscle. The medial side of the thigh is occupied by a group of muscles called the adductors, which are involved in adduction of the leg, or turning it towards the median plane. Among others, this group includes the adductor longus and the adductor magnus muscles. As previously mentioned, the adductor longus is the medial boundary of the femoral triangle, and the adductor magnus contains a canal-like opening called the adductor canal, which is also called the hunter's canal, through which the femoral vessels and nerves pass. This opening also serves as the point at which the femoral artery terminates and becomes known as the popliteal. The posterior aspect of the thigh contains a group of muscles commonly called the hamstring. These muscles, in which flex the lower leg, include the biceps femoris, the semitenoideus, the semimembranous. At the base of the popliteal space, running at an angle from the bottom of the femur to the top of the tibia, is the popliteus muscle. The inferior border of this muscle marks the point at which the popliteal artery terminates by bifurcating into the anterior and posterior tibial arteries. Several other muscles of the lower leg include the tibialis anterior in the front of the leg, and the gastrocnemius, and the soleus muscles in the posterior lower leg or calf area. Both the gastrocnemius and soleus are attached to the heel bone, by which strong calcaneal tendon, commonly called the Achilles tendon. These 2 muscles have to do with extending the foot, thus allowing you to stand on your toes.